Well, welcome everyone on this beautiful sunny spring day. It's been nice to get a little sun. We've had quite a bit of rain the last couple of days. I'm Greg Toczydlowski, president of business insurance at the Travelers, former chair of the United Way of Central and Northeastern Connecticut board of directors, and a member of United Way's Tocqueville Society. But when people ask me in the community what I do, I quickly reply, "Oh, I'm a farmer," because I am. And I'll come back to that in a little bit. I want to thank all of you for joining us in our panel discussion of food insecurity. This is an important issue, and we're thrilled to have so many of you interested in today's topic. As today's event gets underway, please know that it is being recorded. We're excited to welcome members of our Constitution and Tocqueville societies into attendance today. We also welcome members of our United Way's Emerging Leaders Society, also known as ELS. Thank you for joining us, ELS team. To those leaders in corporate philanthropy and foundations who are present this afternoon, thank you. Thank you for being here. On behalf of United Way, thanks so much to all of your generosity, compassion, and commitment to creating positive change in our community. Although this is the proverbial preaching to the choir, all of you who have shown up are already so committed to our communities, and we're incredibly grateful for that. Events like this afternoon's are intended to share information and hear your thoughts on topics like issues affecting the well-beings of families, individuals, and children in our neighborhoods and communities. How United Way, in partnership with community and business leaders and philanthropists like you, are responding to such issues. How when we unite together, we can create a community in which everyone has equal opportunity to succeed and thrive. During today's discussion, you're going to hear about ALICE. ALICE is an acronym. It stands for Asset Limited, Income Constrained, Employed. These are households that, despite having a number of employed, still struggle to make ends meet because the cost of living outpaces wages. So who is ALICE? ALICE is our neighbors, it's our family members. ALICE is our hardworking, essential employees who keep our businesses, companies, and economy churning. I just read the 2020 ALICE report, and it revealed that more than 1 in 3 households in central and northeastern Connecticut are ALICE households living paycheck to paycheck. And let me give you a couple more disturbing but compelling facts around why we need to help ALICE households. Of the 395,000 households in our United Way jurisdiction, 11% are at the federal poverty level and 24% are at ALICE level. So a total of 35% are either poverty or ALICE households, 35%. Of our backyard neighbors. In Hartford, Connecticut, that number is 64%. In New Britain, 54%. In Windham, 54%. All 3 of those communities, over half of the households are either poverty or ALICE households. And they're one emergency away from a financial crisis impacting their ability to feed their family, as well as to provide their basic needs. ALICE households are many of the households served throughout the United Way's partnerships and the great work that we do in the community. Today's topic, food insecurity, is a long-term problem we have not solved in society. Katie will talk about that. She talks about that in her book. Just in this morning's front page of the Boston Globe, we had an article titled, "Hunger's Reach Widens." A new survey by the Greater Boston Food Bank shows how widespread food insecurity remains. Again, another proof point that we've got a lot of work to do on this topic, and I'm personally passionate about it. I grew up in an ALICE household, a single parent household, and I'm proud to say it took 3 women to raise me. A little bit of a Diablo at times, but it was my mother, my grandmother, and my sister. So if you need a recipe or a button sewed, I'm your guy, raised by 3 very talented women. My mom was a home economics teacher and working many other part-time jobs just to give us kids a somewhat normal life. But I clearly remember food stamps were a critical component of helping us meet our basic needs. Fast forward to today, I mentioned I'm a farmer. I'm blessed to share I'm not only a farmer, I'm a philanthropic farmer. With all our clean food and 100% of our profits, usually from selling alpaca gloves and hats, are donated to a local community council. It's a passion of mine to be a little bit better farmer each year, and it's a shared passion with my family. My mom and pop are actually 2 of our workhorses on the farm, and they're actually in the audience today. So hi, Mom and Pop. Thanks for joining us on our discussion. So let me work through a couple logistics. If you have a question or wish to make a comment, use the chat box down below or simply raise your hand on the screen. We'll have time for Q&A later in the town hall. I'd like to introduce the moderator for our panel discussion. Dr. Katie Martin is the Executive Director of the Institute for Hunger Research and Solutions at Connecticut Food Bank Foodshare. She's recognized as a thought leader on food security issues and has over 25 years of experience developing and evaluating holistic solutions to hunger. She earned a PhD in nutrition science and policy from Tufts University and has presented her work at dozens of regional and national conferences. As Katie describes herself in her bio, she is happily married. That's an important adjective for a married, is the proud mom of 2 sons, and is the host parent for an exchange student from Nigeria. Katie's the author of a new book titled Reinventing Food Banks and Pantries, New Tools to End Hunger, which was just published in March 2021. I just read Katie's book last weekend, and I found it fascinating and compelling around why we need to transform our food banks and food pantries. Katie's book will serve as the framework for our conversation this afternoon. So with that, let me turn it over to Katie, and thank you, Katie, for leading this discussion.
Thank you, Greg, so much. This is first time meeting you and hopefully not the last. I appreciate your background and look forward to this discussion. Thank you all for being here with us today. I want to thank Paula Gilberto and United Way for hosting us, and a big shout out to Kim Reeves for keeping us all organized and on task and making this possible. So thank you all. As Greg mentioned, I just recently wrote a book, and it's the culmination of over 25 years in my career of focusing on the issue of food insecurity. And most of my motivation for writing this book is that I've always been struck by the social injustice of hunger in a country as wealthy as the United States. It's just really not okay that millions of Americans have to worry about getting enough food at the end of the week or the end of the month when we have so many wonderful resources. The goal of my book is bold yet simple. It's to reinvent the way that we provide charitable food in the United States of America. We have created this really wonderful, robust national system of food banks and food pantries, and we're doing very good work, but we can do better. And I highlight a lot of key topics throughout the book, but rather than just focusing on the problem and how sad it is and throwing a lot of numbers at it, I really wanted this to be inspirational as well, to highlight a lot of really innovative, awesome programs that are happening. And today we have 3 fantastic examples of local initiatives to tackle food security, food insecurity more holistically. And I also wanted the book to be action-oriented. So rather than just focusing on this as a problem, we're concerned about it, at the end of every chapter, I highlight key action steps that you can take in your community today, because there's so much that we can do and need to do to reinvent the way we tackle hunger. And Greg, I appreciate you bringing up the Greater Boston Food Bank study. It's a great example. We're the only other food bank, along with Greater Boston Food Bank, that's been part of this National Food Access Survey. And one of the key findings that they highlight and that we found in a recent study was not only that food insecurity has really increased during COVID, but looking at reasons why people may choose not to go to a food pantry or to receive SNAP is the stigma. It's the concern of what will other people think? What will that mean for me? And that's part of what I really want to highlight in today's panel too. And as we think about our renewed awareness of food insecurities, particularly during COVID, we know that there are many households that are Alice households that need extra help, but may not always know where to find it, or may choose not to take advantage of resources because of stigma and humiliation. And I think there's a lot we collectively as a community can do to reduce that stigma. I highlight a lot of best practices in the book, and we've got great examples today. And through our Institute for Hunger Research and Solutions, what we do is discuss these best practices. We create resources and webinars so that other people can take advantage of this type of work. So thrilled to have you all here today. And what I'd like to do is to introduce all of our three panelists and have them talk a little bit about their work and how it relates to our topic today. In chapter 7 in my book, one of the key themes in my book is that it takes more than food to end hunger. And I describe how important it is to connect with additional community resources to help connect when people come to a food pantry for food, that we try to connect them to many other resources. And Dr. Marlo Greponne, she just earned her PhD recently, so huge congrats. Dr. Greponne is the Executive Director of the Human Resources Agency of New Britain, HRA. And Marlo said that chapter 7 really resonated with her. So Marlo, can you introduce yourself and say a few words?
Absolutely. Thank you so much, Katie. And thank you to United Way for this opportunity to share on the work that we're doing here in New Britain that didn't just, materialize out of thin air, but really is a compilation of many years of effort, on behalf of many partners in the community that really saw the need, back in 2008, HRA, when I was director of planning and programs at the time, of course, HRA was approached, by the local United Way of New Britain and Berlin at the time, because the United Way had identified a need around food insecurity for New Britain through a UConn study that had been issued that stated that New Britain was 168th in food insecurity across the state. So, it's like every other initiative that occurs, right? This journey started because an invested party in our community saw that there was a huge need and chose to take action. So, that group of folks at United Way started to approach the local community organizations with this information and really get us, some of us that had not been necessarily paying attention to that particular stat, were made aware of it. And of course, certainly, because we're all very passionate about addressing the needs of people who are, experiencing poverty in the community, felt strongly that it was something that needed to be addressed. So bringing partners together was a key piece to this, and building on the successes of others that are already providing was also an important theme to this. So the United Way connected the New Britain community to the Plainville community because they had a food pantry in place that had resources connected to the food distribution, but in a different way. What made our piece unique was that as the community partners began to come around the table, and at the time we had over 25 of them, so too many to mention, but to mention a few, American Savings Foundation was also at the table, Salvation Army was also at the table, Friendship Service Center. So all of those local organizations and many volunteers like Miss Barbara Krajcik, but who was like a huge leader in the process. But once everyone started to join the table and really talk about the different resources that each partner could contribute to addressing the issue, that's when it became clear that there was an opportunity here for the community to go beyond providing a food distribution and really look at getting at the root cause of the issue. And that's part of what you talk about in the book when you're talking about levels of engagement, for poverty reduction. In New Britain, the conversation very quickly moved to, why is it that this food insecurity exists? And what exactly is the need that is causing it beyond the need for food? that we could then address with some of the other resources that might be available through partners in the community or new resources that would be required, which certainly our foundation organization partners at the table were making a commitment to raise. And so that's really how the journey started in New Britain. And it ended up with 2009, our New Britain Food and Resource Center opening and growing till today, where it's serving over 1,500 households on a normal year, many more than that on the current year. But it's integrated a variety of services in addition to the food distribution around financial literacy education, volunteer income tax assistance, energy assistance, case management services, all of these things, in addition to providing the food distribution with dignity, because it was something that all of the partners at the table really made clear from the very beginning, which is why we established a choice pantry for folks. And over the years, as other needs arose in terms of providing healthier choices and really increasing our healthier choices when they come in for their shopping of their distribution, Foodshare what became our greatest partner in that case, right? Because they were able to provide us with resources so that we can be able to build out those opportunities for healthier choices, where we could put in those displays and really put in front those selections that are being donated by our partners in the community, so that we can be able to offer those healthier choices and really put out food that is going to not just address the issue of the food insecurity, but also contribute to their healthier living.
That's
so
awesome. And this is exactly why we wanted you on our panel today, because you're like such a prime example of a holistic, healthy, collaborative initiative. So thank you for all that you do. We're going to come back to you in a bit. Also want to introduce Brian Ibarra, the coordinator of the CCSU food pantry called Maria's Place. In my book, in chapter 12, I talk about new partners and how food banks and food pantries are partnering with different types of organizations. And in the past 5-ish years, many colleges and universities are realizing that often their students are struggling with food insecurity. And more colleges and universities are recognizing such a need to address food insecurity on college campuses. So Brian, can you tell us a little bit more about your work and how you're addressing food insecurity?
Sure. Thank you for the introduction. Once again, my name is Brian Ibarra. I am a graduate student, actually graduating in May in higher education and student affairs, the counseling program. I had the opportunity to take charge of Maria's Place, and especially after COVID coming back and trying to figure out how we can assist all of our students and make it equitable for everybody. We have CCSU is a commuter-based university, and we also have many students who are DCF. So with that being said, we have a good amount of students who depend on even like a home, like places to live, and that also connects down to food insecurity. So with that, the pantry, which is named Maria's Place, which is named after Maria Alvarez, which somebody who's worked there, who she had passed away and worked there for 32 years and love students, love the campus, and just this place was a place for students to not just get food, but to also gain resources and connect with people, but also making sure that they feel comfortable doing all that. Just quickly, around 36 to 40% of students actually are food insecure, and with that, I actually also work with something called Circle of Care at CCSU to make sure we hit the food portion, the housing portion, and the financial literacy portion. And I'm just excited to share more with everybody.
That's great. Thank you, Brian. And in addition to community colleges, universities, another key partner that has emerged in the last few years, many food banks are partnering with healthcare organizations, recognizing that food insecurity is a social determinant of health. And the Joan C. Dauber Food Pantry at St. Francis Hospital was a complete pioneer in this work. Joan Dauber started the food pantry at St. Francis before Foodshare was established as a food bank, so in the 1970s. And Michelle Safo Agyeman is here with us today. I'm so thrilled because the food pantry is really reinventing itself. And hopeful that Michelle can shed some light on some of the really great work that you're doing during COVID, but beyond COVID as well.
Thank you, Katie. Yes, so I would have to say first, it's an honor to actually take on the step of what Joan C. Dauber established 40 years ago. I would say before COVID, Joan really saw that there was a high number of clients, and not only clients, patients within the hospital receiving care that did have issues really matching up their food to what their diet of what their physician would require. Throughout the time of taking on this position within the last year and COVID hitting, it brought a lot of attention to food insecurity and seeing that colleagues were really going through it. Throughout the time, the pantry has now taken initiative to transition from its basic hand pre-bagging, and now we're converting to client choice. Reason being is because we've actually been able to really listen to our clients. A lot of clients have stated to us that at many times they've been apprehensive to even approach a food pantry. Reason being of judgment, how their car looks, how they're dressed, to say maybe it's not enough or you don't look like you deserve it. And I would have to really bring kudos to Katie because the book itself brings present evidence to what individuals are going through. Right now with our food pantry, with COVID, we've been able to see that there's a multi-generational household change. So there's issues with now with food, transportation, and also holding down a job, and also language barriers. And when I, not only just language barriers, when I say, when it comes to, do you understand English or Spanish or what do you speak? Language barriers when it comes to multi-generational household. A grandmother could be in, we have one client who's a grandmother and now 9 other individuals have moved into her household. So it comes in a factor of providing food, making sure the bills are paid, and also making sure clothing, but also making sure that they have that mental status to continue each day. So with us, we look at the social determinants of health and really try to talk to each and of our colleagues and the clients that come in every day. And just a simple, how are you? And that alone has helped us to establish a safe zone for them and feel that this is a place they can come to at any time. But I'll tap into later, further, give you more information later. Thank you.
That's awesome. Aren't these panelists wonderful? This is exactly what we're talking about. This is how we reinvent our work. So it's no news, I think, for all of you here. I think, we're definitely preaching to the choir, but it's very clear, especially if you're familiar with the ALICE project, that there was already systemic racism, structural inequalities in our country well before this pandemic. But I think COVID-19 really made it very obvious that people of color are at a triple threat. They were already at very high risk for becoming food insecure. With COVID, they were more likely to get sick or become hospitalized or die from COVID, and they're more likely to lose their job because of the pandemic. And so I'm going to ask each of you panelists to talk. You touched upon this a little bit in your intros, but how can we incorporate equity and racial justice in the work that we do, particularly in food pantry settings? And Marlo, why don't we start off with you, then we'll go to Brian and Michelle.
Okay, that's a really deep and long-lasting question. It's work that we've been doing for a long time and work that will continue well into the future, unfortunately, right? But I would say that the most important thing to remember at this time when we're looking at the Alice households and the changes that are occurring in the statistics as the pandemic continues, and then as it begins to taper off, is that those same issues that existed in the past are still here. Those barriers to employment, those barriers to education, those barriers to opportunities that existed for these marginalized and oppressed populations are not going away. In fact, they're amplified. And when the curve turns, it will be more challenging for them, right? To overcome these new challenges that they're going to face. And so it will be very important for everyone that has a voice and everyone that has a stake and a passion in this to invest greatly in ensuring that we're able to pretty much amplify our services to continue to provide the services to the folks that are really going to be needing it most when it begins to feel as if we're out of the woods and just not to be lulled by the sense of false improvement.
Great, thank you. Brian, how about for you? How might you put an equity lens and shed more light on the systemic injustices, and how do we tackle that within our community settings?
Yes, so that is something that is always living, especially right now, like on our campuses. Recently at Ccsu, there were certain situations, but across all campuses, a lot of students are speaking out. And to be honest, like the way to handle it is just to be straight up and upfront and what the issues are. Many times you said in your book and in our discussions that this is more than just food. This provides kind of a voice and shows the things that are being missed in these communities, these places where people aren't really talking about it, and also the meaning behind leaving a can of food behind or rice. Like, what is the significance of that? It's more than just an objective thought. There's so much more to that when it comes down to food insecurity. So, for example, when it comes down to college students, there is a mental health factor that contributes to that as well. So with the whole thing with, the Black Lives Matter happening, that was a lot of pressure happening to many of our students, who some of them decided to voice and other ones decided to kind of break down and kind of go into their own. And adding on the idea of housing or food insecurity creates an environment for them that isn't best for them to succeed academically or personally. So, I feel that with the pantry, what I've been able to do is create an opportunity to make it a bit more equitable and safe feeling for our students, where, say, for example, their names aren't really shown, just more if they put in an order, it's based upon their student ID. Equitable wise, they're able to put in orders online, so they can just go ahead and pick it up instead of having to go actually into the pantry. So, there's numerous ways to make these things equitable for everybody. But I think when it comes down to the conversation of what's going on in the BIPOC community, it really just has to come with having the real conversation and listening to the community before kind of jumping in to try to save it.
Yeah, I really appreciate that. One of the things we talk a lot about is cultural humility and not necessarily cultural competence. I don't know that any of us are ever going to be competent in someone else's culture, but being humble and having that, just as you described, listening and being there, being present. We also, there's new awareness about trauma-informed care. And I appreciate how you were talking about, so much of the tragedies that have happened this past year are traumatic, and so much more so if you have a history of oppression and being marginalized. So I think, part of our work is also becoming more knowledgeable about trauma and how we can design our programs so that hopefully we don't cause more harm. Thank you for sharing that, Brian. Michelle, how about for you?
I would have to, piggyback on what Brian was saying and really emphasize the point of the conversation piece. When I first started a year ago, I basically did the routine of just handing a bag to someone. But as I was able to step back and have that conversation, I understood that it was more or less the constant conversation of building the trust and really understanding, what do you need? What can we help you with? And not just say, we're here, take what we have, and that's it. Throughout that time, I was able to learn that simple things of even calling a client's name in the hallway just to say your food is ready was mortifying to some individuals, where the place where they stood back and they didn't want to get the food. So what we actually have done here at the food pantry, and sorry, I'm going to move so I can show you, to help with that is we've actually created a new system where we're going to now apply ID cards. And it actually has the client's picture and name. And what we'll do is scan it with a tablet. That way we don't have their name out, it's privacy, and we already know their household information. So that way they have more dignified to come in. And when we transition to a mock grocery store, they feel like they belong here. And not only here, it transitions to, because we're a hospital-based system, we have to understand that it's not just food. We're actually building that relationship so they can feel that they feel safe receiving care here. And so we try to align our physicians within our system when they refer, and also our nurses, so that that's that conversation piece. So we're tackling the family as a whole and making sure everyone feels safe. And throughout the time that I've been here, I will have to say, definitely conversating with my clients, I've learned more as an individual. The food options, I've actually asked them, because there's so many people in Hartford who are very different backgrounds. And something that you give to them may not be what they're used to. So what I've done is incorporate is I ask my clients, and I'll just have a conversation with them and say, hey, so what would you like to eat? What helps you out? And I've actually had clients take chicken and put carrots from here, and they'll bring me lunch. I have a lady who's from Jamaica, and because of what I gave her, she made curry chicken and rice, but she did it in a healthy way. And that was giving me the ability to now conversate with her doctor and say, hey, when you sit down with so-and-so, this is what she's capable of doing at home based on her resources. Can you work with her on that? So it's not of judging anyone, but understanding them and really making them feel that they're empowered and that they are doing something for themselves and also with their families, and also for the food pantry itself. Because if we weren't here, if it wasn't for our clients, we wouldn't have a food pantry.
Right. So Michelle, are you saying that not everybody wants peanut butter and a can of tuna?
Believe it or not, no. And no one wants seaweed chips. I tried that before, and the lady asked me if that was wallpaper, and I said, no, it's actually something you eat. So it's very interesting when you hand someone something and they give it back to you, and they don't throw it in the trash anymore. I have to say that. I used to get clients who would leave it on the bench or throw it in trash, and now it's, hey, let's go through the bag and we talk about it. And there's new recipes that I never thought of that they use in their household with the items, or sometimes a client may have too much peanut butter. Exactly. So we shouldn't feel offended that they're giving it back. They're being honest, and we have to welcome that.
Right. That's awesome. So I appreciate the group of folks that have decided to spend part of your Thursday with us, are very much engaged in, the greater Hartford community. And one of the things I talk a lot about in my book is if we want to move away from short-term transactions of food towards relational work and hopefully transformational work, so that we can address the root causes of food insecurity, these systemic inequalities, so we can move towards transformational change, we can't do that alone. Whether we're at the food bank or the food pantry, we need to partner with others in our community. And by that, I mean partners in the nonprofit sector, but also government agencies and private industries, businesses. How do we collaborate holistically in our communities to engage in this work? And part of my hope is that we can move away from the concept of tackling food insecurity is just a basic need, and think of it more as how do we think more holistically of our partnerships in the community, that we're building a stronger, greater Hartford. So I wonder if, Marlo, you touched upon this initially. HRA has been collaborating with many other groups for a while, but how would you say the nonprofit sector has responded, and what other partnerships you're looking forward to engaging with?
Thank you. Really great thoughts there. So I think that sometimes when we are caught in the process of delivering, right? Because we're very passionate about what we're doing. It can get overwhelming, and so an area where partnerships can grow is certainly in around addressing those trauma-informed pieces, that trauma-informed care, really helping to work to help the families that are coming to the pantry to overcome those experiences, and to really build their own networks. Because that's one thing that we have all talked about, and really focus on is, teaching them how to do for themselves, really to find a way to build those skills that are going to help them to help themselves. Certainly in the philanthropic area, I did touch upon that, because it's a reality, in order to wrap around services with delivering the food, we need resources, so it's really been fantastic to have United Way as a partner. When the pandemic came on, for example, the Neighbors in Need Fund was able to allow us to expand the offerings to the hundreds of people that came daily to the food pantry, so that we could provide them with PPE and other things that they needed in order to be able to establish some level of safety within their homes during the pandemic, because that became a need for of course, the people that were in the Alice households did not have the resources to set up for themselves. So it's really creating opportunities to be responsive in the moment, to provide resources that are flexible enough so that we as community partners that are delivering can be able to be responsive as well to the needs of the people that are coming for the food as they evolve.
That's wonderful. And Brian and Michelle, how about for you? Any other sparks of inspiration that you can give to the group of other potential partnerships or ways that we might engage with other community groups, so that they can think about how we tackle food insecurity is maybe broader than we've thought previously? Other ideas for collaborations?
I would have to say, from a food pantry standpoint, really collaborating with local farmers and really connecting with them. Reason being, because here at the food pantry, throughout the years, it's always been vegetables in a can, which is not really realistic for a lot of people from different cultural backgrounds. Here at the food pantry, we have now really partnered with, we have our partnership with Foodshare, we have our partnership with Lever International and local gardeners on really providing more solid fruits and vegetables. It's something where I would say people from various cultures feel more at home when they receive those items. They can do more with it, and they can say it stretches a long way. So those partnerships, and really looking at even the clients itself. A lot of these clients are entrepreneurs, and they're doing so much in their community that sometimes food pantries or even local area resources can bring that to them, can bring that entrepreneur to surface where they can do more for the community. And there's a lot of people who really want to help out. So really just having that conversation and seeing what's out there and connecting with various resources.
Yes, when it comes to, obviously with our pantries, a little different. We have the privilege to be able to connect with various departments, various clubs, various organizations that are willing to assist and help us. So for example, recently, a business fraternity decided to do a 3-day food drive for us. When I saw what they collected, it was amazing. It literally refilled the pantry once again. We have the opportunity to always receive monetary donations from alumni who want to assist with the pantry, because they were also assisted when they were a student there as well. So we have those opportunities to always reach out to alumni, to various departments, and even, for example, we have social work. Our social work students need community service hours, and a lot of them decide to connect with us due to the connections that we have with the community. And our pantry doesn't just feed our students, but also our faculty in need. So that's something that also needs to be understood, that it's for the entire campus community. But yeah, that's I guess the good thing about being on this campus, is that we have various outlets of ways we can partner up. We do obviously partner up, like Stop and Shop is really close to us. And the idea was also to partner up with mom and pop shops who want to donate and give as well, especially during Thanksgiving and Christmas. We get a lot of those requests and donations.
Yeah, awesome. So I want to make sure we have time and space to answer questions from all of you wonderful folks who are spending time with us. So feel free to put a question in the chat box, or just take yourself off of mute. I think we can handle it. If you want to pose a question to any one of us.
Hi, this is Tom Buckingham. All the great work that you've talked about is fantastic with healthy food and client choice, and many of those topics. A couple of you mentioned earlier some additional wraparound services around financial literacy. And I'd be interested to hear more about how you go about that, who helps with that, how you measure success, anything along those lines.
I can take that one.
Go for it, Marlo, you can start.
So we developed in partnership with United Way and the Yukon Extension Program, a program that's called Money and Menus. And so how we do this, of course, is we integrate the curriculum that they have at the Yukon Extension Program. They are providing the metrics for what the folks are learning around making healthier choices as they shop and eating on a budget. And then within our Foundations for Financial Independence program, which is also supported by United Way, we're providing the financial literacy education and budget coaching. So those workshops are tailored so that the budgeting skills are overlapping with the healthy shopping skills and the healthy meal preparation skills. So that the goal is that, of course, around food, they're obtaining a variety of different skills that can help them comprehensively. So as they are learning around financial literacy education and eating on a budget, hopefully that extends further to help them to be able to manage their overall budget better, and eventually get to a place where they're resolving their financial situation in the home.
Hi, Tom. Tom's been a wonderful, longstanding board member of Foodshare, so I want to acknowledge him. Thank you. Other questions?
Oh, sorry.
Oh, go ahead, Brian.
Financial literacy is very important when it comes down to our students. I had mentioned before, we have something called Circle of Care, and it is led by, we have a financial literacy portion in that section where if we see students in need, they're either referred to us or they join in on the conversation with Dr. Gladys Cologne. She is amazing. She knows so much in regards to financial literacy. So we help with, completing the FAFSA, financial aid, scholarships and grants, understanding loans and repayments, maintaining the budget and money management, credit scores, credit reports, like, even how to open a bank account, or if they want to study abroad. So for the student side, there's a lot of opportunity to learn about that, but also if there is hardship, we also provide that with a scholarship appeal. There is a money set aside for those students, and specifically. So financial literacy is something that's very important for our students, also just because a lot of them don't have that information or have never been exposed to that information or those conversations. I know personally, I didn't really have those conversations in college until afterwards. And it's something that is very important for them to understand the meaning behind what these loans are, what grants are, and how to budget, especially while in college and out of college.
That's great. Thank you, Brian. How about other questions from the group?
Katie, we have one in the chat. It says, could you explain more about how you work with farms in Connecticut to address food insecurity, especially urban and community farms?
Michelle, do you want to touch on that one?
Sure. So right now, well, actually for the past 10 years, right adjacent to our pantry is the Bird Off Clinic. They established about 10 years ago a community garden, which was overseen by Yukon residents. That was there for many years. Throughout the time, we saw that there was a higher need for, more fruits and vegetables. So what we did is we actually, through a connection from Foodshare, which Foodshare always connects us with everything, which is amazing, we were able to connect with Levo International. With that, we've been able to establish 2 hydroponic systems here at our community garden. And we're now going to go forward with actually offering 1,000 buckets, which is a program that Levo International has established where they provide a Home Depot bucket, and anyone who lives in an apartment or a house will be able to grow their own particular vegetables or fruit, just seeing where the location of their home is, and also maybe possibly get a hydroponic system in their backyard if they have an apartment or a house or something. What we also do is, for myself, I actually drive around, believe it or not, and sometimes called the pantry woman because of my color of my car. They know who I am. And I actually introduce myself to local gardeners, and I see little gardens or farms or whatever, and just introduce what we're doing and see if there's a way we can partner. Or even if a a client's looking for some way to give back, I will link them to that individual. And we're still looking of ways. So this is something we just started a couple of months ago, but if anyone has any ideas to share resources, we're welcome to take that in.
Okay, how cool is that, huh, everybody? It's a great example of building relationships, just starting those conversations. That's really great. Other questions?
Katie, another question. It says, with some of the large distribution sites closing operations as part of some reopening, like Rensselaer Field, what do you want people to know about food insecurity today, and what do you expect it to look like in the next year, given the economic impacts of the pandemic?
Yeah, it's a great question. I'll touch on that one. We've done a few studies of people who are newly food insecure and going to our large distribution sites. Like you've probably heard about the ones we've done in East Hartford at Rensselaer Field. We've done some other ones now as a merged food bank. And it's shocking. 70% of the people who were coming to Rensselaer Field last spring and summer had never used a food pantry before COVID. So a big part of our work there is to raise awareness about our other existing programs throughout the community, like HRA, like our community college programs and CCSU and Hartford, Trinity Hospital, like really understanding all of the food pantries, mobile programs that already exist in our community, letting people know about the SNAP program, how to apply for SNAP, other resources. And I think it's a big part of our job, as I touched on a little bit, is trying to reduce the stigma and help people recognize that any one of us can need help at a certain point in our lives, and to not feel less than or ashamed to go seek help. And I think that's certainly, there's going to be a long tail from this pandemic. So people who were already on the cusp of poverty, the ALICE population, these are folks that it's going to take longer to recover from this pandemic. So all of us, I think, need to do our jobs of raising awareness about programs that exist, make it easier and more convenient for people to get help when they need it. Other questions?
Someone wanted to piggyback on the previous question about urban and community farms. And it says, is gleaning something that can be taken advantage of in the fall?
Mhm. I know, I'll see if anyone else on the panel has comments. I know through Foodshare, we have done some gleaning in the past with farms. So the idea is, after a crop is harvested, that you can then glean leftovers. I think one of the things that we're really trying to do is working with farmers and retail stores of getting the first. So making sure that we've got high quality food and making sure that we're kind of gleaning year round and taking advantage of resources so that the folks who are struggling with food insecurity aren't kind of getting the scraps, if you will, like really highlighting. We've been doing some really wonderful partnerships with retail stores and being able to take more of the perishable food items, so fruits and vegetables and dairy, so that we can bring it right from the grocery store to pantries and bypassing the food bank and just going directly to agencies so that they can be used as quickly as possible. And Greg, I don't know, as a farmer, if you have other thoughts on engaging with farmers and gleaning and any of that good stuff.
Lots of them. We're going to have to get together after this conference here or this panel because it's just so interesting. And there's, so much waste on farms. And so how could we, eliminate that breakage? And I think it's all about education and awareness. So would love to have more discussions around that.
If I could add something really quick, there's again, another way to support food insecurity is through congregate meals and of course food soup kitchens. So this gleaning may be a better resource for those distributors of food that are providing prepared meals. Just a thought.
Does anybody else have a question that they want to put in the chat, or please feel free to take yourself off of mute. Okay. I've got a question. I'm interested in learning more about partnerships with K through 12 in our communities that might help increase accessibility to food for families through pantries. Is this something that is happening in our communities?
Mm-hmm. Yes, and I'll let Michelle chime in a sec. What's been interesting nationally, years ago, many food banks started to partner with schools in doing backpack programs. That was, a really popular way of having a food pantry that would put together backpacks and then distribute to schools. But what we're finding is that's not always the best, most dignified way to provide food, but rather having food pantries on sites, just like you would at a college or university, or like you would at a hospital or a community setting, is having the food pantry at the school and letting families come and shop for the food and get other wraparound services. Michelle, do you have another thought on that?
Yes, actually, about 5 months ago, I was approached by 5 high school, middle school nurses and social workers who indicated that a lot of their students and families were expressing issues with food. There was one particular high school that stated that the teen moms there were actually not showing up to classes because they had to work part-time jobs just to have formula, food, and diapers for their children. So I have now partnered with every nurse and social worker that if they identify a family, a parent or a family member, whoever needs food, they actually can come in and receive food here. The nurses have said that they just slip in a brochure into their pamphlet, into their book bags, and then they will come in and receive food. What I've done with one particular group of students is that because their children are in the daycare center and they're teen moms, I give them diapers monthly. I connect them to the social workers here to address any other issues they may have. And we also utilize 211, Bertha, to find out if there's any local resources that we can tackle that can help them to take away that, I would say, stigma of needing help. And then also trying to work with, I've also worked with our colleagues here who have opened up donation baskets within their homes to get gently used clothes for their babies. I would say the first thing is just a conversation. To have all these nurses come to me, a lot of them said they knew there was an issue, but they just didn't know how to address and bring it up and what resources were available. And they didn't want to make their students feel that they were judging them and saying, oh, I've seen something's going on, here's to help you. They waited for them to come and say, I need that help. And that helps still the connection piece that we have here.
Thank you. I think that's probably the last question we're going to be able to take right now. I don't see any more right now in the chat. So with that, I'm going to ask Greg. Greg, would you like to go ahead and
bring us home?
Bring it home.
Absolutely.
Thank you.
Thank you, Katie, Michelle, Marlo, and Brian. Those are great experiences on food insecurity. I learned a lot myself, and certainly be asking a lot more insightful questions in our communities to just make sure that we're providing more holistic and sustainable changes. So a genuine thank you. And thank you to all of you, our guests on this afternoon's panel, and always our generous partners who are helping us with doing our United Way mission. Before we conclude this afternoon's event, I did want to share with you some opportunities to engage with the United Way to help address the root causes of food insecurity. These are actions and opportunities that are one of the antidotes to food insecurity solutions. And these are opportunities to give, advocate, and volunteer. One of them, if you're a golfer, we've got our first inaugural live, really important term there, United Way golf tournament on Tuesday, May 25th at Shuttle Meadow Country Club in Kensington. Proceeds will be invested in United Way's COVID-19 fund, which will provide financial resources for a coordinated approach to ensuring basic needs of families like food are met. So please, you can see the hyperlink, take a picture, a screenshot, come out and have some fun. Golf is very secondary. The primary beneficiary is, of course, our communities. On June 17th, we have another event at 11:30 a.m., and that's our United Way's Women United at the 10th Annual Power of the Purse event. I've been participating in all 10 of these, and it has just been fascinating watching it grow. This is a virtual event. This year's keynote speaker will be Lucinda Cross, president of Activate Worldwide. And the proceeds are just so important here because the data from the National Women's Law Center shows that in Connecticut, women make up nearly 67% of the low-wage workforce, and that women are 2 times more likely to hold a low-wage job than a man. Per the 2020 Alice report, 73% of single female-headed households with children are Alice households. Proceeds of the Power of the Purse are invested in United Way's economic mobility work, which includes our United Way supported programs in which participants work to identify financial goals, develop realistic budgets, reduce debt, build savings, increase income, and receive career coaching, helping ensure women and families in our community are more financially secure. You can register at the hyperlink, you see it there. And if you've already donated to the United Way's annual campaign, please consider making an additional donation. You do so much for the United Way, you can go right to their website. Your support is needed now more than ever. As Katie noted in her book, to create lasting policy, positive change in our community, we do need systematic change around public policy. And so consider advocating on behalf of Connecticut United Way's 2021 policy agenda. You can learn about that by visiting the hyperlink. If you have time or talent which you'd like to donate, visit the United Way volunteer site. United Way can't do all this critical work necessary to ensure everyone has equal opportunity to thrive without your partnership. And we know you get that. That's why you're here today. Finally, stay invested and stay focused on the issue of food insecurity. I highly encourage you to take time to read Katie Martin's book. You'll learn more about the issue, and there's solutions that are just intuitive to highly sophisticated that's going to take a lot of our society to work through, but they're very holistic in the solutions. So again, thank you for attending today's panel discussion, and thank you for your generosity, your support, and your care of our communities. Enjoy the sun out there. Thank you, everyone.